This week on The Wheelhouse. Calling Dr. X. Paging nurse practitioners. A message from Washington, D.C. regarding those student loans. For Connecticut Public, I'm Frankie Graziano. This is The Wheelhouse, the show that connects politics to the people. We got your weekly dose of politics in Connecticut and beyond right here. Last summer, President Donald Trump signed into law a massive federal tax and spending plan. Starting in July, according to that plan, the Trump administration will limit borrowing for students seeking professional degrees. Those loan caps will impact prospective doctors and nurses enrolling in postgraduate studies. This hour, we're talking about loan caps for prospective medical pros at a time when one federal lawmaker says you can't afford to limit that borrowing. U.S. Senator from Connecticut Richard Blumenthal is here to discuss that and developing news regarding now deposed Venezuelan President Nicolas Maduro. Senator Blumenthal, thank you so much for coming back on the show.
Wonderful to be with you. Thanks for having me.
Good to see you. Good to see that you're working down in Capitol Hill. We appreciate that very much. If folks want to ask the senator a question or you want to ask us anything regarding these professional degrees, you want to share any thoughts that you have, give us a call. I do want to start off, obviously, with some breaking news here, or developing news, rather. The United States Senator Richard Blumenthal has attacked Venezuela, apprehended Maduro, and the legal process is already underway with Maduro here in the United States. It's not the first time, Senator Blumenthal, a president has sort of circumvented Congress here and taken military action. But what are your thoughts on the Trump administration's actions here in Venezuela?
I'm deeply disturbed and worried that we've embarked on a lawless, reckless invasion without any clear plan for what our goals are, what the exit strategy is, and what happens in Venezuela and the region now that we have destabilized it. And the meticulous planning that underlay this brilliant operation went for months without any consultation with Congress. In fact, we were deliberately misled when we were told in briefings that the only goal was to intercept narcotics. In fact, they were planning this military operation. We can admire and praise the stunning brilliance and expertise demonstrated by Delta Force. But the fact is, now we have extricated the head of the corrupt administration. We've left in place Maduro's hench people, principally his vice president, now interim president, Rodriguez, and the narcotics dealing, the Iranian influence, all the malign factors that led to this invasion are still there, plus repression is continuing. Now, Trump seems to be all about the oil. He's talking about how oil is going to produce revenue for the United States, but the oil companies are very reluctant. In fact, they seem to loathe the prospect of going into Venezuela, investing billions of dollars when there are already owed billions of dollars for property taken from them. And there are serious risks to their investments, their employees, the oil that may be extracted. So what happens now? What is the plan? And what is the exit strategy? What are the goals? And we have these distractions about possible invasion of Greenland, action against Cuba, Colombia. It is a worldview that I think is deeply dangerous. And remember the Colin Powell adage, if you break it, you own it. And we are owning something that could lead to very serious consequences and costs.
Maduro faces 4 criminal charges, including narco-terrorism conspiracy. U.S. Attorney General Pam Bondi says Maduro and his wife, Celia, will soon, quote, face the full wrath of American justice on American soil in American courts. I've got a clip I'm going to play for you, Senator Blumenthal. Here's a local party leader responding to the situation. Chair of the Connecticut GOP, Ben Proto. Here's what he had to say.
I don't think it was an attack on Venezuela. I think it was an action to arrest a criminal. So I think Donald Trump did a great thing in bringing Maduro to trial. I think it was well executed. Thank God for our military.
Would you unpack what you're hearing there, Senator Blumenthal, about this not necessarily being an attack and an action to arrest a criminal is what the local party chair is saying here in Connecticut?
Well, listen, Frankie, I'm a former federal prosecutor. I did that job for 4.5 years as United States Attorney. I'm former Attorney General, serving 20 years in that role. Maduro is a bad guy. He's done terrible things. He's cruel, criminal, a dictator who has repressed his people, tortured, and imprisoned them. But he wasn't arrested walking down the streets of New York. He was extracted as a result of a military invasion of a sovereign country. And the way he was apprehended has grave implications for our national security. In fact, the question is, was the military properly used to apprehend this criminal? And the defects in the legal action here may not exonerate him. In fact, he belongs behind bars. But now we are involved in a much larger operation with consequences to the thousands of airmen, sailors, and Marines and Army troops who are in that area. We have about 1/5 of our whole naval strength in the Caribbean off the coast of Venezuela right now. That is a huge and costly commitment. And my fear is, and it seems to be proving true, that we are involved in some endless operation here, akin to what happened in Iraq, where the best day of the United States operation there was the day that Saddam Hussein was deposed, and afterward there was chaos, conflict, and confusion that was immensely costly in lives as well as taxpayer dollars.
We played for you a clip from a local Republican. Here's some reaction from local Democrats. This joint statement was texted to my colleague, Connecticut Public Latino Communities reporter Danny Doncel. It comes from Puerto Rican leaders in the state legislature, state representatives Christopher Rosario and Geraldo Reyes Jr. As events continue to unfold, my foremost concern is in the well-being of the men and women of our U.S. Armed Forces who may be serving in harm's way. I am keeping them and their families in my thoughts and prayers. And of course, they're go on to say, and I join in hoping for their safety and their swift, safe return home. Also deeply concerned for the people of Puerto Rico and those affected by related travel disruptions, including Connecticut residents who are currently seeking to return home. I urge all relevant authorities to prioritize the safety of everyone on the island and to work expeditiously to ensure that travelers are able to return home safely and be reunited with their families. So I guess the natural question there is that statement came as the situation unfolded over the weekend. Obviously, news has developed since then. There were airspace restrictions in place in Caribbean spaces like Puerto Rico and Aruba. Are you hearing from constituents who are worried about family in the area or being able to access that area of the Caribbean?
I've heard from some of the Venezuelan community about their concern for relatives who may be victims of continuing repression, arrests, and confinement in Venezuela, because this government seems to be much the same as it was before. You have the same narco-terrorists, the same military, the same political authoritarian leadership there that Maduro cultivated and established. So I'm hearing those concerns among the Latino and Hispanic community in the United States, and obviously concerns about travel and about implications for Puerto Rico, our fellow Americans in the island. But travel seems to be okay for now. They're rightly worried that instability and chaos in the region could imperil travel and economic dealings in the hemisphere, because plunging Venezuela into chaos, not to mention Colombia, if there are refugees coming across the border, or into Central America could be profoundly destabilizing for the entire region and indicate and impact the economic dealings there.
Really an incredible start to the new year, Senator Blumenthal, at a time when lawmakers were supposed to be focused on the next budget battle. I'm sure that's something you're thinking about. But funding for several U.S. agencies runs out at the end of January. Would you take us, if you can, Senator Blumenthal, into the room and help us understand if this situation in Venezuela has gotten in the way of any negotiations or maybe postponed any votes? Just kind of help us understand how it's impacting things, if at all.
We need to have a budget by the end of January, and we're working at it. I think it is doable. We have what is called a mini bus as opposed to an omnibus budget right now, which concerns a number of selected agencies like the Department of Homeland Security. Obviously, it's involved in the Venezuelan situation and in immigration. And I am pressing, by the way, for increased funding for the nonprofit security grant program, which protects our synagogues, mosques, churches against anti-Semitism, Islamophobia, other kinds of hate violence. I was the author of the No Hate Bill, and I've been a strong supporter of this kind of funding, which is in that measure. And I think the need for it is increasing as a result of the actions that this government is taking abroad, that Donald Trump has threatened there and in the United States. So I'm hopeful that we will develop a budget and pass it by the end of the month so we don't have another government shutdown, which obviously is to be avoided.
As my colleague, federal policy reporter Lisa Hagan reports, any prospective shutdown early in 26 would be smaller in scale than the one we saw in 25, the longest government shutdown in American history, as you talked about omnibus versus minibus here. A big bone of contention for Democratic lawmakers during that budget battle was the expiration of health care subsidies emanating from the Affordable Care Act. House Democrat from Connecticut, Rosa DeLauro, says a vote will happen in her chamber Thursday that would extend the subsidies and potentially support, I think she said, some 143,000 Connecticut residents experiencing this sort of benefits crisis here. What are you hearing about the health care subsidies, Senator? What's happening in your chamber?
It's a tragedy. Health care subsidies have expired. Hundreds of thousands of people in Connecticut face health care costs spiraling upward and insurance premiums now unaffordable for many of them, thousands of them in Connecticut, millions around the country. And the lack of healthcare insurance means, for many people, lack of healthcare. They can't afford healthcare insurance because the premiums have doubled and tripled without the healthcare tax credits that Republicans have blocked. Republicans, in effect, caused the government to shut down because they were unwilling to talk realistically about supporting an extension of those healthcare tax credits beyond December 31. So at midnight, the beginning of the new year, this tragedy and travesty is unfolding for hundreds of thousands of people in Connecticut who look at the open enrollment period and are saying, can't afford it. If I'm going to pay rent, groceries, utilities, can't afford doubling and tripling premiums, and literally increases of thousands, perhaps tens of thousands of dollars over the months and years. So healthcare is so vital to Americans, and we're going to keep fighting for an extension of these healthcare subsidies, including hopefully a vote in the Senate. But I wouldn't anticipate that the government will shut down again.
A lot of costs here going up for people. We're talking about groceries. We're talking about, you were talking about healthcare. And of course, we have rent and mortgage payments, a lot of things for people to pay for. Urgency to increase or replace federal funding streams after cuts laid out in the federal Republican tax and spending plan signed into law last July. One particular cut you're highlighting is caps placed on federal student aid for people seeking professional degrees. You've characterized the move as stupid. Why?
It's stupid and it's cruel, because what we are doing for example, on nursing is to put a cap, a very unrealistic one, which defies reality, on the amount of loans that nurses can take to do their job, which is so necessary. And here's a stunning fact about healthcare in Connecticut, and it's true of healthcare all around the country. We have a shortage of nurses. In Connecticut last year, there were about 2,900 openings, only 2,600 enrollees. And the reason is it's a tough job. It is so demanding. And for many who burn out, it leads to people wanting to seek other kinds of professional opportunities. But denying America the healthcare it needs, the nurses that are so necessary for the care that doctors provide and other healthcare providers contribute, I think is penny wise, pound foolish, stupid, and cruel, because it will cause needless suffering for the nurses who remain and have to do these jobs when they're overworked and the hospitals are understaffed. It is also cruel to patients who have to go without some of the key nursing skills that these healthcare providers are engaged in providing.
And in terms of the provision of the skills, too, a lot of the concern is about teaching and having nurse pros to be able to teach the next generation here, as we're talking about graduate studies. U.S. Department of Education rejects that they're making sort of any sort of value judgment here about the students looking for aid in these scenarios and devaluing the work, whatever they're saying there. The federal government distributed a fact sheet, according to CT Mirror reporter Katie Gavala. We're going to have her on the show later. That shows that many students, is what they're saying, won't be impacted by the caps. What do you say in turn to the Department of Education?
Well, first of all, nurses who seek higher professional degrees are the role models and the teachers for others. And second, the cap will affect many other nurses. And many of these nurses have a right to be outraged that the administration has concluded that nursing is not a professional degree. That's the official line that they've concluded. Nursing is a profession. Degrees in nursing are professional degrees. And demeaning the profession of nursing in this way discourages people from undertaking it when we need them more than ever, and the job is more difficult than ever. So I think it's highly irresponsible, and it just shows the adversity of this administration to education as a whole. As you know, they are about to unrealistically make demands on students who have taken loans from the government. They're going to be denying opportunities to extend those loans, to take public service forgiveness of student loans, and this kind of discouraging and demeaning of higher education is really profoundly damaging long-term to the country.
What can you offer next to these folks? I understand that the state government may step up. At least there's some kind of effort there to try to keep some folks studying here in Connecticut, and there may be some money provided. What are you telling nurses and doctors, these prospective medical pros, at this time?
We're going to be fighting for any kind of stipends, any interim grants or loan programs that may be available, and we're going to be fighting the cuts and caps that are imposed by this administration. I'm the ranking member on the Veterans Affairs Committee, and we see, particularly in that agency, cuts of literally 30,000 positions. 30,000 positions, which are physicians and nurses, schedulers, counselors, key healthcare providers, and workforce that's necessary to do the compensation and benefits that veterans deserve and rightly demand. They've earned it. We owe it to them. And as the ranking member on the Veterans Affairs Committee, I am going to be issuing a report in just a week or so, portraying in total what has been done in degrading healthcare to our veterans. But veterans also depend on Medicaid, which has been cut. Veterans depend on the healthcare tax credits and subsidies, which expired on December 31. We need a full court press to maintain and enhance healthcare in America. We shouldn't be satisfied with what we had before. It was ridden with problems, and we recognize those problems. We ought to be trying to enhance, not degrade our healthcare system, including healthcare insurance, which Americans need and deserve.
Senator Richard Blumenthal, I am so appreciative of you stopping by to mark the new year here at the Wheelhouse on Connecticut Public. Thank you for coming by, and we look forward to the work that you have ahead of you in 2026.
Thanks so much for having me, Frankie.
Thank you, Senator.
Thank you.
Big year ahead, as we mentioned. We got the midterms and more, so a lot of work for Senator Richard Blumenthal to do as well. After the break, a university president from Connecticut joins us to talk about the impact of federal cuts on local colleges and universities. If you want to talk to us, you want to react to what you just heard from Senator Richard Blumenthal, give us a call, 888-720-9677, 888-720-9677. Stay tuned for Goodwin University President Mark Scheinberg. More Wheelhouse next on Connecticut Public. This is the Wheelhouse from Connecticut Public Radio. I'm Frankie Graziano. We just had U.S. Senator Richard Blumenthal on the show in the last segment. He talked about the situation in Venezuela, the federal funding fight on Capitol Hill, and our topic du jour. I went to Montreal for New Year's, so I guess I speak French now. We're talking about federal loan caps for students seeking professional degrees. Joining us now, an administrator at a Connecticut university. Mark Scheinberg is the president of Goodwin University, nonprofit institution of higher education based in East Hartford. Good morning, President Scheinberg.
Frank, thank you so much for having me. Thank you for bringing up this as a topic. I think it's such a critical thing that you're doing, and I appreciate it. I'm a fan. I listen to you every morning, so thank you.
Oh, thank you for coming on the show. We appreciate you coming on the show, and thank you for wearing purple as well. I think he gets the assignment, as you see. Before I start our conversation with President Scheinberg, I'll invite any working student or anyone with questions about these loan caps to give us a call, 888-720-9677. If you want to get in the Wheelhouse today, leave a comment on our YouTube stream as well. We just heard from Senator Richard Blumenthal. Is there anything he or other federal lawmakers are saying to give you hope for the future of higher ed in America?
I will tell you, I've been around for a long time, and I had no sense that this would be what I would be going into so many years ago. This image of this, ivy-covered walls, and you smoke a pipe in front of a fireplace somewhere. No, what's happened for higher education in America is not only swinging wildly, but it's happening so fast that it's impossible for us to make intelligent decisions at times. We're having to move from our gut because the changes are happening so fast. We can't adjust large organizations around what's been 220 executive orders since this president has come in. It's just too fast for us to keep up with. So how's it affecting us? What would give you hope? What would give you hope? There's a lot of people that really believe in this mission. There are people that work in this field for a lot less money than they get in the private sector because they believe in our students, they believe in education, and they believe in what education does for our future. It's a future of every individual we have in the country.
Senator Blumenthal's reasoning in calling the loan caps stupid was that they are being implemented as a nursing shortage grips the country. Our students at the university, the state of Connecticut, we're going to talk about the mechanism in a second. There's some things that you want to talk about. Are they going to acutely feel the impact of the shortage, at least? Because I want to bring up Goodwin University when I talk about educating nurses and doctors, because this is something that you try to do. You try to churn out professionals. So are you going to acutely feel this impact that the senator is talking about here in the shortage?
Incredibly, in a number of different ways. Goodwin University, we've been told by our hospitals, account for about 30% of the working nurses in our area in those hospitals, as well as 30% of respiratory therapists, 30% of a number of different health professionals, dental hygienists. They all come out of this school. And so it becomes critical. And we know that we have many students who are not going to be able to continue or not going to be able to start school because of the limits that have been put in place. In particular, we do programs in APRN. Now, yes, it's a nurse, but for all purposes, the APRNs in our state have become the new primary care physician. You go to a clinic, you go to your own doctor's office, chances are you're talking to a PA or an APRN. You're not talking to the doctor. And that is by necessity because the shortage of primary care is so great. There's between 1.5 and 2 million visits to emergency care centers in Connecticut every year. Those people are mostly seeing APRNs and PAs. APRNs in this law is not considered professionals, and so they should not be supported. And yet, if they're not there, then there's nobody there. This will affect not only everybody in the state, but particularly people in poor communities or in rural communities, because those communities are even less served by regular physicians and more served by APRNs or PAs. And so if they cannot be trained, the impact will be very quick.
Just like a doctor, these nurse practitioners can also prescribe medication, of course, and they can see patients. And since the pandemic was underway, there's been a move to allow nurse practitioners to also do telehealth. That has been a big boon in these communities. And shout out to the work that they do, including my wife, Colleen Graziano, NP, who is a fantastic nurse practitioner. So thank you for shouting out the work that they do. Hey, the federal government, in talking about these shortages, what date are you worried about? We were talking about July being where this starts. When are you looking at the biggest impact? Has it already arrived?
It has. Remember, when you have a student apply to school, those of you that have kids going to college, you're getting your financial package February, March, at worst April. You're making plans for the fall. We have students calling us right now getting their packages for the fall, which, by the way, is after July 1st. But they're not going to wait till July 1st to find out how it's going to shake out. They want to know today. And frankly, we don't know what to tell them. They're asking very logical questions. How much am I going to pay? Where's it going to come from? We have no idea. So
is
yes.
part of that you may get money from the state, hopefully, or something like that you're looking for?
Right. Yesterday, they had a press conference with Senator Slapp and Representative Haddad chairing this conference where they are proposing putting some money into essentially a backstop or a guarantee fund for CHESLA so they can begin to give some funds to graduate students who will be affected by the federal bill so that there will be another way to get subsidized student loans for students so they're not put into the private loan market. And so I'm hopeful that the legislature deals with this, but not at the end of the legislature. It has to be passed in the very beginning of the legislative session. Otherwise, colleges won't have the guidance that they need in order to talk to students.
Because they're applying now.
Because they're applying right now.
That is a very important thing to bring up and a very big nuance factor in all this. We love nuance on the Wheelhouse. The federal government, at least in putting these caps through, a couple of things they're saying. One that I want to get to here is that most students won't be borrowing enough to be impacted by the revised student loan caps. There is a moving target, too, because they're changing the classification and things like that. So what do you say to the Department of Education?
Well, the Department of Education, first of all, is creating national law. whether we like it or not, it costs more to live in Connecticut than it might cost to be in Oklahoma or Alabama, and the cost of colleges are a little bit higher here, and so some arbitrary number that they say is the cap isn't as fair in every part of the country. Those sort of indexing ideas tend not to work. Secondly, the cap that they gave is so low; it's $20,500 per year in graduate school. Now, no offense, but that's not a huge amount of money. I'm not saying that people should be charging absurd amounts of tuition, but a $30,000 tuition would not be considered a high tuition anywheres, and you're already short. So the need for more money is real, and the idea that that cap is going to be enough is silly.
And that is what the federal government is saying too. They're hoping that that these institutes of higher learning are going to charge less money for school. Is that something that you're having to kind of cope with at this time? Is that an option? Is that something that you can do at this point?
So keep in mind, you mentioned the whole industry and how we're looking at things. The two things that come to mind when I hear that, one is that the discount rate in this country is nearly 60%. So that's
you're not even paying the sticker price.
Right. The sticker price is people paying less than half the sticker price, and so so that part makes that absolutely silly. But more so than that, look how many schools are closing. If this was such a fat industry that we are making all this kinds of money, we wouldn't all be closing. There are more schools that are on the red zone, they would call it, for accreditation than ever has happened in history, which means that they are all in a position of being very fragile, and that's across the board. No, we're not going home with piles of money in the bank. There are exceptions, and there will always call out those schools that have the $1 billion endowments, and they are toted out every time. They are the small minority.
When you say fat cat, I'm thinking about Fat Cat from Chip and Dale or something like that. We see that often when we see protests of unions and things like that. Certainly not seeing a fat cat in front of me here, but you talked about those exceptions. You talked about whether or not these nurse pros and these medical pros are going to be feeling this acutely. What other kind of concerns do you have at this time? What other things do you need the legislature to address here in Connecticut?
So the big issue that they're dealing with is graduate students who need support for graduate school. But what wasn't as recognized, because it's a smaller piece of the law but really critical, is that for undergraduate students attending school part-time, their loan eligibility just got cut in half. And that may not seem like anything but an arcane fact. But what happens is that for a student who's going back to school to become nurses, those students at this point have got their loan eligibility cut in half. So if you are a working person, 85% of the students at Goodwin University are working adults. And for those people, they can only really come to school part-time. They can't quit their jobs and they have families, 2/3 are single parents. They need to go to school part-time. That's the best they can do. If the funds are cut in half, they can't afford to come to school. And I don't know if I can make that more stark than I am, but I'm telling you that the institution that provides 30% of your nurses, their students who are largely very highly diverse, who are many times multilingual, they're not going to be able to have the funds to go to school unless they either quit their job and go full-time, and the feds are good with that, or if they go to the private market to borrow money there. And by the way, these students coming in don't have any credit, so the private market is really not looking for them either.
It sounds like there's a double whammy there. So you have your graduate students that are impacted, and you also have undergraduate. And just to sum this all up quick here, there is a time crunch. While the law does really impact people here in July, obviously you have people applying for school now. So there is a lot there. Can we try to find maybe some optimism here? What gives you hope? What can you do here? What's a way to look forward here?
Well, what gives you hope is, first of all, we are finding solutions. We are finding ways to save every dollar that is possible to keep tuition low. We are finding ways to more deeply partner with industry so that there are less gates to get people out of school and into jobs. We're doing more work at the high school level so people are coming in with credits and can do things more quickly. We're turning every knob that we have. And so higher education changes lives, one at a time, but entire communities in aggregate. One quote that one of our APRN students, when they found out about this, they said, 5 years ago, the nurses were the heroes. A big deal was made about how they braved the COVID and went into work and did everything. And where are we now? Like, where is all that love about, and where's that appreciation that we're just trying to do our job? And for all that work, we should be supporting them as much as they have supported us.
Where's the love? Where's the beef in terms of the finances in order to support these institutions? What a fantastic conversation we had. I know we wanted to make sure we catch up, and we are diving into that nuance that we have on the Wheelhouse here, and can talk about the fact that there's acute impacts that could be felt in the summer and obviously here in the middle of the winter and in spring. So a lot of work for you all to do at this point.
Well, we appreciate having a Wheelhouse, because most of these things can't be answered in a slogan or a bumper sticker. And it's only here that you get it 2 or 3 levels deeper so you understand what's really happening. So thank you for being here.
I appreciate it. Happy 2026 to you and your institution. We hope for good things for all of the students here at Goodwin University. Mark Scheinberg, the president of Goodwin University, thanks for coming into the studio to appear on our show.
So glad to be here. Thank you.
Thank you so much. After the break, hear from a reporter following next steps for students impacted by the caps. There's more Wheelhouse next on Connecticut Public. This is the Wheelhouse from Connecticut Public. I'm Frankie Graziano. Today we're talking about working students and new federal loan caps. Those kick off in July as part of the Trump administration's big spending and tax package. We've heard from U.S. Senator Richard Blumenthal and Goodwin University President Mark Scheinberg. Now we're going to go to reporter Katie Govala to break down what we've heard today and the actual outline of the federal government's adjustments to professional degree loans. Katie's a health reporter with Connecticut Mirror. Thank you so much for coming on the show, Katie.
Thanks for having me, Frankie. Happy New Year.
Happy New Year to you as well. We got a lot to dive into. Folks, if you're a student reliant on federal loans for your education, what do these upcoming changes mean to you? Give us a call, 888-720-9677. All right. All show we've mentioned that prospective nurses and doctors are impacted by the loan caps. There are levels to this. 11 programs qualify for professional degree status as outlined by the United States Department of Education. Students in that tier are subject to caps, and then there's degree fields that aren't classified as professional. They face caps as well. Can you explain who's in, who's out, who gets capped harder?
Yes. So previously, the federal government had a program called Grad Plus, and that lent money, basically lent all the money you needed for your degree. So it was essentially unlimited up to the cost of what you needed to get that degree. So that program is going away. And now they're saying we're instituting caps. And it's worth saying, you pointed it out, their claim is that these these unlimited loans really led to the ballooning cost of education, and that they're hoping to control that. So now there are two tiers. There are going to be caps, and there are two tiers of caps. And the first is what they're calling professional degrees, and those include doctors, those include pharmacists, those include dentists. I think there's a list. It's about 11 degrees, and they would qualify for $50,000 a year, $200,000 over the course of a lifetime. And then you have a second tier. These are graduate programs. So they're not being defined as professional by the federal government. These caps are half of what those professional degrees get. So $20,500 a year, $100,000 over the course of the lifetime of the loan. Now, it is also worth saying that the Trump administration says, look, we do respect nurses. This term professional, we're using it as an internal definition for the sake of delineating the caps, and that this does not have a reflection on how we view their role. Of course, you have nurses reacting pretty poorly to that, as well as elected representative like Senator Blumenthal.
Yeah, because there's a clear tier there, as you see. There's the nurses and there's not. And the nurses are not included in that highest tier. But then also, if you're a doctor, you're facing a cap for the first time.
You're
as you
facing a cap for the
mentioned.
first time. That's right.
That's the big complaint that they have. So that's kind of the higher level look at it. As I outlined earlier in the show, and you just got to this by saying that they're not trying to necessarily say that they're making a value judgment here. They're sort of downplaying the issue, saying a majority of students subject to the new caps don't borrow enough to be impacted. Can you help us understand this fact sheet that they released? What did you find out?
Yeah, so that is what they say, that about 95% of the students who borrow under the limit, and also that only around 17% of nurses nationally have these advanced degrees. But as we heard Senator Blumenthal say, if you are, you've done your bedside nursing and you're ready to be a leader, whether that be teaching, whether that be going into policy work, whether that be becoming a nurse practitioner, you need to go and get that advanced degree. So in a way, this is impacting the leaders of that nursing industry. And so
many people saying, where's the love at this point?
Yeah.
It was important to hear that from Dr. Scheinberg earlier as he was talking there, but continue to finish your thought.
Yeah, and so what's interesting, though, is that we went to a press conference. I went to a press conference where there were probably like 12 nurses standing in the background, and you've probably been to a million of these. They're kind of boring, but a fellow
who's going to speak next?
Right, a fellow reporter I thought did an awesome thing. He said, "Hey, can just show of hands, would this cap have impacted you?" Which I thought was such an interesting question. That type of thing never happens at a press conference, and everyone raised their hands. So, I can't say that I've done the reporting to verify that claim by the Trump administration that 95% of people wouldn't be impacted. But at least in that room, it seemed like there would have been an impact to their education. And these were professional nurses. So
what you're going to hear from the nurses either way is that, as you mentioned earlier, if you're going to be a lead nurse, if you're going to advance the field, you're going to need this degree because somebody's going to have to teach these nurses.
Yeah.
So it is 17%. This is the big figure, right? This is the X factor. 17% of nurses seeking these advanced degrees, but that 17% teaches the next generation.
Yeah.
And so we'll see where that goes. They're the professionals as well. Anything Democratic lawmakers can do, or is this the type of deal you'd need a change in federal leadership to overturn these load caps?
No, so as Mark mentioned, the Lamont administration is looking to help support people who are impacted by these new caps. They're putting together a state loan forgiveness fund. I think it's going to be something around $10 million. And, that's the amount of detail we have at this point. But we're excited and paying attention to learn more in the coming months, hopefully.
Not a lot of detail there. And this is kind of where the rubber meets the road, at least in terms of the interview we just heard. I know this is something that was rather intriguing to you, too, to hear it from Mark Scheinberg. we're not necessarily thinking about the undergraduate students impacted by this.
I was talking to him in the green room. I did not know that piece, to be honest. I focus on healthcare, not on education, so I really came at this from the graduate nursing program angle. But that is a fascinating statistic.
And what it means in the interim here, the upshot of that is it looks like there's going to be so many things that lawmakers have to do in 2026 because of Medicare costs and cuts to the federal government. They still haven't passed laws consistent with the recent voting referendum that we had. They'll try to do that. And now somebody's going to come in here, and they're obviously going to talk about energy prices as well. That's always the elephant in the room. But now somebody's going to come in here and say, hey, we have kids applying for school. We have these working parents applying for school, and they don't know what they're going to need in terms of financial aid.
I don't envy their jobs.
You'll be there to follow it. We're not done yet. The interview with Goodwin University, Mark Scheinberg, president, a news release we got in advance of that. I think this came from the state lawmakers. It said, quote, working students in the Connecticut state colleges and university system borrow an estimated $17 million per year through affected programs, and institutions such as Goodwin University, known for educating working nurses, are expected to feel that impact acutely. Are you seeing that? Are you hearing something similar to the figures he's talking about where they're educating 30% of the nurses in the field at hospitals?
Oh, yeah. I mean, we've been hearing acutely about the nursing shortage going back to COVID, and people referencing that even before COVID, this was a problem. So I think the state needs, this was a report from 2020, but at that point, the state needed 3,000 new nurses every year just to make up for the number of nurses that were retiring. So this didn't even account for nurses leaving the profession because of burnout or anything like that. And at that time, I think we were getting 1,900 new nurses a year. So we're not replacing nurses at the rate we need to be.
888-720-9677, the number to call if you want to join us and talk to us on the Wheelhouse. We have a statement from Kat in Middletown who wants to address this, Cap. Kat, the federal government says they're not putting any value judgments by making these classifications. What do you say?
I say they certainly are, and it's just a continued attack on women because they are cutting teaching and nursing, professions that are traditionally female dominated. And I think that's what we get for electing a pedophile. And it all circles back to the Epstein files. This is a man who does not respect women.
Kat, thank you so much. And that's something that we're hearing a lot of frustration with what's happening in Venezuela, a lot of these kind of disruptions and distractions that Senator Blumenthal was talking about earlier. A lot of folks want to make sure that they're keeping on the prize here and focusing on the issue at hand. And the one we're focusing on today is here what's happening with these loan classifications. Kat in Middletown is certainly thinking that this is misogynistic. They're saying they're not making any sort of value judgments. You did mention that you covered the news conference yesterday. You did mention that there is some work being done at the state level. Let's talk about healthcare subsidies now. Yeah. This is something you're going to be watching. We only have a couple of minutes left in the show. You heard me talk to Richard Blumenthal about healthcare subsidies. According to U.S. Rep. Rosa DeLauro, votes coming in the House. Where do lawmakers stand on extending the Affordable Care Act subsidies?
Honestly, I'm not extremely hopeful that is going to happen.
And it sounds like Senator Blumenthal said that it's not really happening in the Senate at this point.
Yeah, I think the idea is that it may pass in the House, but it will not pass the Senate.
So that shows you that in the coming days, that's something that lawmakers are going to focus on, but might not necessarily be something that gets done. I know you're paying attention to subsidies. Our colleague Lisa Hagen is as well. Mm-hmm. It's hard to ask with all the developing news out of Venezuela, but any potential government shutdown, would it hinge on the extension of these subsidies? I
don't know. I guess they had the longest
It's $1 million question.
They had the longest government shutdown in history hinging on those subsidies. I can't imagine it would have the same momentum going in. But, we should also mention that this is another area where Connecticut is responding. So the governor has pledged around $115 million to go towards helping some of the most financially vulnerable people who are going to lose access to these subsidies. So they're going to keep premiums free and low for those people who were getting that assistance from the federal government.
Senator Richard Blumenthal saying earlier it's a tragedy what's happening with healthcare subsidies. If you want to follow along on this reporting, I know we're going to be asking this question. Katie and I and Lisa Hagan, we're going to be texting on how the healthcare subsidies come up in these conversations. Will there be another government shutdown? It may not be as big in scale. It may not happen at all. Senator Richard Blumenthal says he doesn't expect it. These are the things that we're going to be talking about on our private text chains here, just to give you a little bit of what's happening. You've been listening to Katie Govallo. Follow her reporting. Katie Govallo is reporting at ctmirror.org. Thank you for coming on the show.
Thanks so much, Frankie.
Today's show was produced by Tale Ricketson. Welcome to the team, Tale. It was edited by Patrick Scale. Our technical producer is Eugene Amatruda. Special thanks to Robin Doyen-Aiken, Isaac Moss, Megan Fitzgerald, Connecticut Public's visuals team, and our operations team. Download The Wheelhouse anytime on your favorite podcast app. I'm Frankie Graziano. This is The Wheelhouse. Thank you for listening.